Hello, I'm Dr. Dan Wilgus. I would like to thank you for donating your time and energy to the Oklahoma Mission of Mercy. In this video, I'm going to go through what you can expect when volunteering during this event. Patient registration is the first stop for patients entering the clinic. As a patient registration volunteer, our goal is to make each patient feel welcome and at ease at Oakmont. When you arrive at Oakmont, please grab your name tag and t-shirt from the registration desk. From there, you will go to the patient registration area of the clinic. Look for a volunteer wearing a blue t-shirt. Volunteers in blue t-shirts are area leads, and all other volunteers are in black. The patient registration area lead will lead an orientation with the newly arrived volunteers. When the clinic building doors open at 6 a.m., patients will be led from the overnight waiting building to the clinic building in groups of 25 to 50 patients. Patient registration volunteers work together to check in the patients, following the patient check-in steps outlined later in this video. While we want to work as quickly and efficiently as possible to get patients through the door, we don't want them to feel like herded cattle. Please treat everyone who comes through the door as our guests. You are one of their first impressions coming into the event, so smile and make them feel respected and welcome. You are making a difference in each patient's day and in their experience. Communication is the key. By letting them know what they can expect, answering their questions, and keeping them organized, you will help the patients relax and have a more positive experience. Translators and signers for the hearing impaired be stationed throughout the building in bright neon vests. Besides checking in patients, patient registration volunteers are also responsible for helping to bag and label the patient's personal belongings, escorting them to the designated waiting area, and loading clipboards with patient forms and placing them along with breakfast bags on the patient waiting area chairs. You also may be asked to escort patients to the restroom, as patients and family members must be accompanied by a volunteer at all times while in the clinic. You will also make sure the patients stay in order and move them to the next area for triage when available. Now, let's go through the patient check-in process. Direct anyone not receiving dental care to the family and friends non-patient waiting area. The only exceptions are parents and guardians of minors and caregivers for disabled patients. Some patients may be mentally disabled or suffer from extreme dental phobia. Ask the patient registration lead for help in determining when caregivers are allowed. Encourage patients to leave behind their bulky belongings with family or friends. The patients may also check their belongings with an Oakmont volunteer and pick them up following the completion of their dental treatment. Put corresponding numbered yellow wristbands on patients or guardians and their children. This may already be done by overnight waiting personnel. This is one of the most important things we do. All minors must be accompanied by a parent or guardian at all times and must have a wristband. Each set of 2 wristbands has the same unique number. Put one on the child and one on the adult. Do not hand them to the child or the parent. Attach them yourself. If there is more than one parent with the child, each parent should be banded to the child. That means the child will have 2 wristbands. If a parent has more than one child, each child to be banded to that parent, so the parents will have as many wristbands as he or she has children. Put corresponding numbered yellow wristbands on disabled patients and their caregiver. No one enters the clinic without either a wristband or a patient number. If the caregiver is not receiving care, they will not receive a patient number. So it is imperative that they have a wristband in order to stay in the clinic building and gather, tag, and store bulky items and strollers. To keep the clinic floor clear, bulky items such as blankets, chairs, and other items must be stored. Put the items in the large plastic bags provided. Use the colored wristbands provided by the lead to tag the items. Each set of 2 wristbands has the same unique number. Put one wristband on the patient's wrist and staple the matching wristband to the bag containing their items. No strollers are allowed on the clinic floor by fire marshal decree. They must be stored. Do not bag strollers, just attach the matching blue wristband to it. Be sure to let the patients know that they will be led to their property claim area to pick up their items after their treatment is complete. Do not store purses or personal property of significant value like electronics. Backpacks may be stored or kept with the patient. However, be sure the patient keeps all medications, baby supplies, and anything they may need during the day. Patient registration volunteers will distribute patient numbers. The patient registration lead will designate who is responsible for distributing patient numbers. As patients pass through the entrance of the clinic floor, one volunteer will be responsible for handing each and every patient a numbered card. No one receives dental care without a patient card. White cards go to adult patients who are without children receiving dental care. Lavender cards, or pedo cards, go to children 12 and under and their accompanying adults because they are all served by the family or pedo clinic. There can only be one accompanying adult per child. Other adult family members must go through the regular clinic and receive white cards. After these processes are finished, the patient is then escorted to the appropriate seat in the waiting area where there is a patient registration form and pen attached to a clipboard and a light breakfast. The patient is instructed to complete the patient registration form and wait for further instructions. If a patient needs to go to the restroom during their waiting time, they must be escorted. If no runner volunteer is available, you may be asked to escort the patient to the restroom and back to their designated seat. No patient should ever be unaccompanied on the clinic floor, and their clipboard with the completed patient registration form should stay with them as well. Thank you for volunteering at the Oklahoma Mission of Mercy. We could not provide free, life-changing dental care to our neighbors in need without you. I look forward to seeing you at Oklahoma